Hey you guys, so after I read this comment, I thought it was so ignorant that I was just going to delete it, but I was like, you know what? This can actually be a teachable moment. So let me give you guys a backstory. So Dr. Janelle Greensmith recently passed away. She was a nurse midwife and she had her doctorate. She dedicated her career to making sure that all women receive fair treatment when they are giving birth. And she was able to help over 200 women give birth in safe conditions. Okay, so she was doing really good for the community, and unfortunately, she passed away recently while she was giving birth to her first child. And this situation is just so backwards, and it's just so unfortunate that this happened to someone who was actually serving others. So I made a post, and the post was dedicated to her and other women like her. And this is a comment that someone made. They said, "It is what it is. Black women have higher risk factors inherited. Some folks are predisposed to such. Janelle wasn't mistreated or ignored during labor." Lately, I've been seeing women of color that have had terrible experiences in the hospital. There was one patient who was in a wheelchair. She was crowning, and the nurse was just sitting at her computer. The nurse just seemed like she didn't care, and it just felt like that patient was not human. And there was another situation where a patient had to give birth in her car because they denied her care at the hospital. Okay, and this stuff, it has to stop. So here are the facts. Black women are 2 to 3 times more likely to die during childbirth compared to white women. Those are facts, meaning that there's data to back this up. There was also a study that was conducted that showed that medical students and residents endorse false beliefs about the biological difference between Black people and white people. So they believe that Black people have thicker skin and less nerve ending, meaning they feel less pain. If a Black patient comes in and they stated that their pain is 10 out of 10, their healthcare provider, with that implicit bias, may believe that it's only a 5 out of 10. So it can be really, really dangerous because it leads to undertreatment and really negative outcomes. Interestingly, there was also another study that showed that Black women's pain was the most underestimated out of all racial groups. So between Black men, Black women, white women, white men, Black women's pain was the most underestimated. So these are prime examples of implicit bias. Implicit bias are automatic and they are below conscious awareness. So people don't even realize that they are thinking these things sometimes. And when you're not aware of something, there's no way that you can change it. And this can lead to really bad outcomes for women of color and men of color as well. But just speaking on maternal morbidity and mortality, this is what's contributing to Black women having higher mortality rates. So when you see that patient that was in the wheelchair and the nurse was just completely ignoring her, she most likely just completely tuned her out. She just didn't hear her pain at all. And this stuff is really unfortunate because it is costing people their lives. One thing I'm really happy about is that people were coming together. There were nurses and doctors and so many people of different races in healthcare that came together to hold this woman accountable. And they knew that this was not right and the patient was not treated the way you should treat every single patient. And they held her accountable. And I want to see more of that. When you can bring certain things to people's awareness, it's just going to help everyone look within and just reconsider how you're treating every single patient. I just want to end this by saying that let's just be kinder to people online. Just because you have not gone through an experience, it does not mean that it's not real for so many other people. Someone who gave their life to trying to save their patients and help their patients in so many different ways and just trying to help them have a better outcome, just passed away. So let's just honor her and so many other healthcare providers that are doing their best and just do better as a society.